Hi, I'm Tom Bagwell, and welcome to Hello Health, a partnership with the Ochsner Health System and Humana to bring Ochsner's Hello Health weekly education and information series to you. Our topic this week, orthobiologics and the role it plays in the treatment of sports and other orthopedic injuries. Our guest is sports medicine and orthopedic specialist, Dr. Andrew Gottschalk. First, some background. Dr. Gottschalk is a graduate of the Case Western Reserve University School of Medicine. He did his residency and internship in family medicine at the Mayo Clinic. He completed his fellowship in primary care sports medicine at the Cleveland Clinic. His experience includes treating athletes at both collegiate and professional levels. As Ochsner's Director of Primary Care Sports Medicine, Dr. Gottschalk serves as the head medical team physician for the New Orleans Pelicans, and it is our pleasure to welcome Dr. Andrew Gottschalk back to Hello Health. Good to see you, friend. Welcome back.
Hi, Tom. Thanks for having me back.
Yeah. So what the people at home don't see is this wonderful personality of yours, which keeps people laughing and smiling and just this positive outlook on life that often keeps people laughing. So how do you marry that? And we'll talk about the whole marriage thing and what that can produce at the end of the program. You see, I'm all over this. But how do you marry those two personalities of keeping people in stitches, he jokes again, but also the seriousness of the work that you do?
It's true, because I think on one hand, medicine's incredibly serious. I mean, it is nuts and bolts, mathematics and science, and a seriousness that comes with treating patients, treating human bodies. On the other, I'm a firm believer that good medicine is about communication. And if you can't talk to people, if you can't relate to people, if you can't connect with people, you can't do good medicine no matter how smart you are. And I see time and time again very, very smart men and women who make mediocre physicians because they just can't talk to people on a human level. So I really make it a focus of my practice in my life to be able to connect with people, because it starts there. That is the bedrock of good medicine.
We've all seen the t-shirts, baseball is life. For you, you should have one that says medicine is life.
Medicine is life. Communication is life.
Good.
Absolutely.
When we talk about orthopedics and sports medicine, what are we talking about?
So everybody should know what orthopedics is. There are 206 bones in the human body. They come in all shapes and all sizes, and they are responsible for the structure of us. And on top of those 206 bones, there are many, many, many different types of soft tissues that keep those bones together in some sort of rhythm and make things like joints. So whether we're talking cartilage or ligaments or tendons, there's many, many components to what makes us us and holds our bones together in some sort of structural function. So really the study of that bone and soft tissue and joint system is orthopedics. Now, sports medicine is actually a step past that, because a lot of sports medicine is orthopedics. You sprain an ankle, you have a sore shoulder, that's orthopedics. But in this country, there are 26 different medical specialties, and sports medicine, a good sports medicine physician has to keep all 26 of those in mind. Yes, you have to be good at orthopedics, but hey, there are 25 other medical specialties over there, because maybe your star pitcher gets a cold, or maybe your star quarterback is going to do some traveling, or you just have to keep things in mind. So orthopedics is the incredibly complex and beautiful study of the human bones and the soft tissues that hold those together. And sports medicine is that, plus every other specialty, how it applies to athletes of all ages and all walks of life.
How long have we really been focused on the true aspect of sports medicine, right? So in the old days, well before both of us, I'm sure, hey, I'm hurt, doc, I'm hurt, coach, walk it off. Or my shoulder's sore, hey, let's just give it some rest.
Right. Well, because I think back in the day, decades ago, there used to be toughness. Hey, being good at sport X is just about being tough. And so if you're hurt, shrug it off, shake it off, get back out there and do your thing. And I think toughness is an important part of sports, but we know that sometimes people are actually hurt. And we know that if you play through certain injuries, you make things worse and not better. So I do encourage toughness in athletes. I do encourage, really through toughness, fitness, and just keeping people fit and keeping people healthy and preventing injury. But at the same time, I think you're right, over the past several decades, especially in American sports and American sports medicine, we now know that shrug it off can be dangerous, and we want to protect people from dangerous situations.
And salt pills can work, but water is better.
But water is, as it turns out, hydration with water is one of the best medicines out there.
I'm glad we're doing that. Junction Boys might have been terrific back then, not so much today. How are orthopedic and sports-related injuries typically treated today?
Yeah, well, if you're doing the right thing, let's take an orthopedic injury. The human body is the most beautiful instrument you're ever going to see. I mean, humans have created a lot of beautiful machines. The human body is more beautiful than any of those and more complicated than any of those. One of the beautiful things about the human body is that it takes care of itself really well. And the vast majority of orthopedic injuries are treated how? Not with a fancy medicine, not with a fancy surgery, are treated with rest the hurt tissue, rehab.
Heat and cold.
Heat and cold, get that tissue back around, and the body's going to take care of itself. So time and rest play a big part in orthopedic recovery and thus sports medicine recovery. Good rehab, good physical therapy, the fundamentals. And so I always tell my athletes, hey, good sports medicine is a lot like good sports. It's about the fundamentals. It's about rest. It's about physical therapy. It's about appropriate use of things like heat and ice. It's about appropriate use of common things like Tylenol and ibuprofen. Tylenol and ibuprofen, $4 from Walmart, is as powerful of a medicine as you're going to need the vast majority of the time.
So those are the basics, but if you play for the Pelicans or you play for the University of Michigan, you have an entire medical staff who's looking at everything. What about Johnny, who's on the 5th grade Little League team, single mother, comes home and he's complaining of pain? When is it time to go see the doctor, and what are the options going to be for the average Joe?
Good point, and I'll tell you why. Because regardless of the level of athlete, professional athlete, collegiate athlete, 6-year-old young man, 7-year-old young girl playing sports in school, the principles of the human body don't change much. Don't change much. And there are times the answer to your question is actually simpler the lower the level of sport, where they might not be looking for something fancy. They might just be looking for, hey, we don't know. Educate us as to what the fundamentals are. That rest, that use of common everyday over-the-counter anti-inflammatories, the use of things like that. So I really feel as though, because you're absolutely right, patients come into my door all the time and they say, you take care of professional basketball players. You take care of professional football players. I want to be treated that well. And I say, hey, you don't know it, but you already are. You don't know it, but you will get that from me. Because at the end of the day, the human body is the human body is the human body. And there are situations that make treating a professional athlete different, but at the end of the day, the body responds to the fundamentals of sports medicine care, which I like. So I can promise them that it's the same treatment and be truthful about it.
When do you know that someone's going to need surgery? Talk through that discussion.
It's a good question, because surgery is absolutely appropriate some of the time. When you know somebody needs surgery is when, if it isn't something dangerous. And in orthopedics does not involve heart attacks. You need something done now. It's not lung disease. You need something done now. Unless you're actually in a car accident or some high-level trauma, which does happen in things like American football from time to time. Usually you don't need surgery for orthopedics right now. So surgery is at the end of the day. At the end of the day being after you've tried the fundamentals, after you've tried the basics. And then really what we're talking about today is, hey, what's in between the fundamentals and surgery? And what's in between the fundamentals and surgery is this new and evolving field called orthobiologics that we're talking about today.
So what is orthobiologics?
It's a big, long, fancy word that I'm not going to have you or any of our watchers remember. But basically, orthobiologics
No quiz at the end?
No quiz
Good.
at the end. Orthobiologics is using not fancy medicine, not fancy kind of external sources, but orthobiologics is using a kind of human tissues to stimulate healing of damaged tissue. So really the most fundamental one, the grandfather orthobiologics is PRP, platelet-rich plasma. And platelet-rich plasma is where we take your own blood, put it into a fancy centrifuge, spin it down, take out the platelets and the associated growth factors, and inject that under ultrasound guidance into a near damaged tissue, and ask those platelets, which are your platelets, and those growth factors, which are your growth factors, to help stimulate healing there. And really, that was the first one that we've been working with for several years, and from that has come this whole field of that's using your platelets, but now we use bone marrow preparations. Now there's some other things like amniotic cell preparations that we use, but basically using biologic sources to stimulate tissue healing.
It sounds like you just described, I don't know anything about blood doping that cyclists use, but it sounds like sort of what I've heard they do.
Similar and different, and that's a good point. So blood doping is where you use a patient's blood to beef up the oxygen carrying capacity of that person. It's similar only in that it's your blood. This is a very specific procedure where we take a very specific component of your blood, hyperconcentrate it, and put it into tissue to stimulate healing. It doesn't stick around other than the time it takes to do that healing. But that's a good point.
So other than healing, there's no benefit. I'm not going to bike faster.
Yes.
My endurance is not going to increase.
It's not going to make your muscle stronger than it was. It's going to help the healing potential of that damaged muscle or of that damaged tendon to get back to where it was.
You mentioned it's my blood. Is that always an option? What if a patient doesn't have the option of donating blood? Can it come from a relative or someone else or some other donor?
In general, the answer is no, and that's because my cells all have my own markings on them. And so if you take your blood and put it into me, if it's not highly processed, my body's going to have a hard time with that. So most of the time, if we can, we're trying to use a patient's own tissue so our patient's immune system doesn't react poorly to whatever that graft is.
What can a patient expect when they have one of these orthobiologic procedures performed? What does it look like? What does it feel like?
It's actually, if you're the patient experience is shockingly quick, because unlike a surgery where you're in the hospital all morning or all day, you are really into our office for an hour and a half maybe. Really the longest amount of time is the processing of the tissue. So if you come in to get a platelet therapy, we're drawing your blood, and that blood goes into a fancy centrifuge, and the majority of the time is spinning it down. If we are doing a bone marrow preparation, which is colloquially called like stem cell therapy, the procedure itself is rather quick. It's the spinning it down and processing it to get those cells out that takes the most amount of time.
Is this stem cell, or is that a whole different procedure?
It's a very good question, because the term stem cell is used inappropriately in advertising all the time. And the reason is this: it's such a great term. If you are hurt, if you have damaged tissue, seeing that somebody can heal you using your own stem cells is a very easy sell. The problem is that is used too often in snake oil type preparations. So I'm very careful when talking to patients about what those cells are and what those cells aren't. So what we're talking about with the bone marrow preparation are your own cells that live in the bone marrow that will someday grow up. They're like adolescent cells that will someday grow up to be other cells. We put them into damaged tissue, asking them to turn into new muscle tissue, new tendon tissue, things like that.
Are people donating their own blood? Is there a shelf life for blood, thinking that I might need this someday?
There is, and it's a better question than you even know, because in the United States, if I take out your blood legally, I have 24 hours. I can't keep it. I can't alter it. I can't change it, and I can't hold on to it for longer than 24 hours, or it's illegal.
Even with my permission.
Even with your permission.
And that's a safeguard against what?
I think it's a safeguard against what you were alluding to earlier, which is you can do like blood doping and other things that can potentially be dangerous. And the FDA is trying to prevent dangerous things from kind of backdooring their way into a patient. So I can take out your blood and really minimally process and putting it back into you that day. But other than that, we have to be careful.
What's the pain difference between a typical orthopedic surgery and using this?
It's a good question, because anytime somebody takes a knife to you, whether it's in an operating room or the back alley, it's a big deal and it hurts. And that is not what we're doing with orthobiologics procedures. If we're doing bone marrow preparations, we are using a large needle called a trocar to get bone marrow out of your pelvic bone. And if we're doing a platelet-rich therapy process, that is a blood draw. So I mean the needle prick of a blood draw, and then the needle stick of putting those platelets back into where the damaged tissue is. I mean, so not being cut open, which leads to not long recoveries, which make it nice because the risks are less.
Is there a topical anesthetic? How does that work before you're going in with this big needle?
Good question. So we use local anesthetics. The prototypical local anesthetic is lidocaine, and I numb the heck out of people before I do any sort of procedure on them. And again, the biggest hole that I make in somebody is maybe yay big. And so a little bit of lidocaine goes a long, long way. We numb the heck out of them, and people do very, very well.
What can we expect and a patient expect after one of these procedures?
So I'm going to tell them to rest. Usually we're doing these procedures on a Thursday or a Friday. I say, hey, TLC, Go home, rest for a long weekend, take care of yourself, have your husband, have your wife do the dishes, have them do the chores for you. But really, the pain levels afterwards are minimal. I remember when I first started doing these procedures, I used to think, oh, these must really hurt people, and we really have to talk about managing pain. And it turns out the first several people we sent home never used a single pain pill. So I think rest, I think keep an eye on things, but people, because of what we said, which is this is not major surgery. These are small, little, minimally invasive procedures to help out bone and joint problems where the recovery is speedy. And by definition, what we're doing helps recovery along. So I do like people to keep an eye on things for a long weekend, but pain levels are minimal at best.
Are these usually the treatment options themselves, or are they going along with some other procedure to assist with that and to assist with recovery?
Good question. I push physical therapy. And I think people who know me believe that we can all be stronger in different ways. And every patient I do a procedure on, I'm encouraging some sort of follow-up with physical therapy to help that tissue recover in the right way. Because you want that tissue to heal, but you want it to heal properly into the structures that prove the best function.
Speaking of that, we want to share with you a video that the doctor has brought along with the help and assistance of the Ochsner production team. So let's take a look.
I injured my hip in October of 2015. This was before the stem cell procedure came to New Orleans, and I was on a cruise ship and they did x-rays and said you need a new hip, and I was like, no, I don't think so. So I came here to Ochsner and I started seeing Dr. Gottschalk. He put me through physical therapy from the time of my injury until when he did that stem cell. It was like impossible. I was in a wheelchair, a walker, and the pain was excruciating. And my only alternative at the time was a hip replacement. And I didn't really care for that thought. And so therefore, I went ahead and I had that procedure done. So they remove bone marrow from your pelvic bone and spin it in a machine, and they get the cells and inject them into the area that needs to have the regenerative process. I stayed in a lounge chair at my house for about a week or two, and I was walking, and 2 weeks later I was walking in the mall. I have recommended this procedure to so many people, and everybody that I know that's come to him has had the same result. They went from right up to the point when you were going to need surgery and replace something with artificial. You were able to keep your body intact, and I would recommend this to anyone. He's very personable. He makes you feel very comfortable. When he's explaining the procedure, you're thinking, oh no, I can't believe I'm going to do this. And it's nothing. It's absolutely nothing.
How's she doing?
Great. And Peggy is the perfect example. She is young, she is healthy, she is fit. She was told she needed a hip replacement, a major, major, major surgery. I think hip replacement specialists do a very good job, but in general, you want to put off that major surgery as long as you can. This is Peggy, and the problem is hip replacements only last 15 years. Even a good one done by the best surgeon only lasts 15 years. So you want to put it off as long as you can. Peggy's young, she's healthy, she's fit, she wants to keep going with her life, doesn't want major surgery right now. So what did we do? We took a step back. We said, let's take it from square one. Let's rest that tissue. Let's rehab that tissue. She's talking about that bone marrow preparation where we extracted those bone marrows from the posterior of her pelvis, of that iliac crest. We took it out, we processed it, and she did great. And what she's saying is true. Hey, the fundamentals don't take months and years. I mean, just in a few months, or in a few weeks, you're already seeing results.
Every patient is different, but in theory, how long does it last? And in theory, could she continue to get them and put off hip surgery forever?
It's a great question, because whenever we do a procedure, there are two fundamental questions. How well does it work, and how long does it last? And right now, there's no algorithm that lets me know that. I can't say, you, Tom, are a healthy 50-year-old man and put those numbers into an algorithm and know how well it's going to work or how long it's going to last. So I mean, it's really dependent on your genetics and your mechanics. So I think that it's like anything else in medicine. There are no guarantees. There's good medicine, but I never make promises I can't keep. And if you ever run into a doctor who's promising outcomes, run away. But so I think, as with Peggy, you do the procedure. How well did it work? It worked excellently. How long does it last? Peggy just came in to get hers redone, and we've redone hers 3 different times. The good news is there's no, I mean, if it works and lasts for an appreciable amount of time, there's no reason not to do it again. Again, it's not a fancy medicine. There are no side effects. It's not a fancy surgery. I'm not putting a knife into you. It is her cells. It is a preparation of her body being taken from site A, concentrated and put into site B. So she can get it done 1,000 times if she wants to, if it keeps working.
In the short term, what can patients do to maximize the success of this, and what are you asking them to do?
And I think for these procedures or for anything orthopedic, 2 things. 1, healthy diet. Treat your body well. I don't believe in miracle cures. Healthy diet is pretty close to a miracle cure. Fitness, keeping muscle groups strong. Every study shows that physical fitness reduces the risk of injury and helps you recover faster if you do have an injury. So I preach those 2 things to everyone.
And not necessarily meditation, but I saw the relaxation.
Yeah, that's true. And I think the relaxation is rest, because it is tough. It is 2019 America. We are all busy. Whether you're an athlete busy, whether you're Tom interviewing people every week busy, everybody's busy, and rest is so important to our health, and we neglect it often. So that is a key component to any recovery.
What about in the long run? What advice do you have for patients?
Yeah, it's similar. A lifetime of healthy eating habits, a lifetime of healthy fitness habits, and not fighting through pain. And you brought this up earlier. It's toughness versus the intelligence of I'm hurt, and don't fight through it. So I will tell patients, hey, let pain be your guide. What can you do? What can't you do? Let pain be your guide. If you're fighting through pain, you're fighting through inflammation. If you're fighting through inflammation, you're damaging tissue. So as long as you know, if you're doing activity X and it starts to hurt your knee or your hip or your shoulder, and you go, that is the world telling me to back off and let that tissue recover, you'll do well.
Very quickly, orthobiologics not yet covered by insurance. Do you think that's going to change?
I suspect as more studies are done and as more data is collected, for certain indications, orthobiologics will eventually be covered by insurance companies. I think that is 5 years out, maybe 10 years out. I don't think for every indication, I don't think for every orthobiologics. I think for some of them it will.
But the early results you're seeing from people like the person we met and other patients.
Yes, are very positive. I mean, so I was just doing an analysis of last year alone, 1 season for 1 professional team, 52 procedures, because they're safe, because you can do them in the middle of a season, and because people get results.
So whether you, regardless of the components of a treatment plan, exercises, as the doctors talked about, geared towards core strengthening can benefit everyone. And we're going to learn more about that in this week's Eat Fit Minute with Molly Kimball.
So we're here at Ochsner Fitness Center in our Fit Lab, our brand new personal training studio. And I'm here with George. He's going to be walking us through some hip exercises.
We're going to show some exercises for strengthening, therefore to have a healthy hip and back.
So we have 2 main exercises that we're doing. The first is hip extension.
Yes.
And it has 2 levels of progression, one with the band and the first though without the band.
Correct. The one is, we're engaging our core. We're making sure that the heel is kicking up on the ceiling, our knee is straight, and our back is straight.
And then the next level of progression, once you're comfortable with that, is adding the resistance with the band.
We have a correct form of mind-muscle connection, proprioceptive work that we can actually perform the movement, and then we go into resistant band. We can have a light, a medium, heavy band according to what we want to elicit.
And then our next exercise is abductors, which I like to call these clamshells.
Correct. And we just abduct, making sure that we have a correct posture on our back. We're laying down and we're actually opening and closing, and we are moving in both directions, the tension.
So you can talk with your physician or physical therapist for a referral to our personal training department here at Ochsner Fitness Center. And as always, check with your physician, your physical therapist, or other healthcare professional before beginning any type of exercise program.
Thank you, Molly. These are the kind of exercises you probably do before surgery and also after you've gone through the regular home exercises after surgery, been cleared by any medical team to again strengthen and get back in. Great tips from Molly as usual. So the last time you were on this program, you gave us all the information well ahead of time. You were right on schedule. We were so proud of you. It really helped with the preparation. This time, you got us the material late, and we were saying, where is it? What's going on? So what happened?
Here's what happened. I had a daughter. I had a young daughter. She was due Easter Sunday and came into the world 2 weeks early, kicking and screaming. And she is beautiful. She is 98% her mother in looks and brains, and thank goodness.
Explain the bunny suit. So you mentioned the Easter timing, but you were actually assisting with a charity, right?
I did. Oh, do we have a picture of that for the show? So there was, I was involved in an Easter egg hunt charity event. And on Easter, and like I said, this little bundle of joy came to us 2 weeks early. So the suit was rented, and I wasn't going to skip out on a charity, and so we brought her along. And this is her already rolling her eyes at me kissing her mother in a bunny suit.
All right, I've got 15 seconds.
Go ahead.
You're obviously someone who loves life well before this new life entered your lives. How has this changed your outlook? How can it be any more rosy or sunnier?
If you had read about the sun and never seen a sunrise, the sunrise would blow you away. And that's what having a kid is like.
Always great to have you on the program.
Good seeing you, Tom.
Thank you so much.
Thank you.
Dr. Andrew Gottschalk, we thank him for the education and information he has provided for his work in the Ochsner Health System too. Make an appointment with any of Ochsner's physicians, including this week's guest, or to register for any of our Hello Health seminars, you can call Ochsner at the number you see on your screen or send us emails. We always love to hear from you at hellohealth@ochsner.org. As a reminder, you can rewatch this week's presentation, many of our other Hello Health programs on Ochsner's website. We hope you'll check it out. Our thanks again to this week's guest, Dr. Andrew Gottschalk. Thanks to Humana and Ochsner for making this program possible. And our final thanks, as always, is to you for your support of this program, Hello Health. I'm Tom Bagwell, and we'll see you next time.